What do you think is the answer to this question? Can you be paralyzed if you have a pinched spinal cord? And if you have a pinched spinal cord, do you have to have surgery? I'll give you the answer to these questions at the end of this video. People come in all the time to my office with pinched spinal cords, and typically the symptoms people have with a pinched spinal cord are things like they tell me their arms and legs feel numb, or their hands and feet are numb. Their balance doesn't feel right. They feel off balance. Their legs feel weak, like they want to give out, and often they do give out and they fall. It's usually not a painful thing. They may have some mild neck discomfort, but they don't complain of a lot of pain. It's more of a functional thing. My hands don't work right. I'm dropping things. My balance is off. My legs feel weak. So to get to the answers of these questions, yes, if you have a pinched spinal cord, you can be paralyzed. The answer to the second question, do you always have to have surgery? The answer is, well, yes and no. I mean, if you have surgery and you open up the spinal canal, that certainly gives you the best chance of not being paralyzed, but it certainly doesn't guarantee it. But obviously, it's a personal decision. I have people all the time who come in, I show them their films, I explain to them they have a pinched spinal cord and they have increased risk for potentially being paralyzed, but they decide that they don't want to have surgery, and that's their prerogative. So, it doesn't always mean when you have a pinched spinal cord that you're going to be paralyzed. There's a lot of people out there right now who are walking around with a pinched spinal cord and they're perfectly fine. But then there's always the unfortunate people who get in a car accident or they slip on the ice and fall, and all of a sudden they get paralyzed. If you suspect that you have a pinched spinal cord or the symptoms that go along with a pinched spinal cord like I described, you should definitely see your doctor or a neurosurgeon. When it comes to the discussion of surgery, you have to see your films, have the films explained to you, have the options explained to you, as well as the surgery, talk about the exact details of surgery, what are the potential risks, what are the benefits, and then when that's all said and done, you make a final decision as to would you want to have surgery done. Obviously, surgery is your best option for the long term, but it doesn't mean it's something that you have to do.